Welcome to BPS Live. My name is Steve Ronan. I'm a plastic surgeon here at Blackhawk Plastic Surgery. Tonight, we're going to talk to you about breast reductions, everything you want to know about breast reductions. As always, I'm here tonight with my co-host, Brette. How are you doing tonight, Brette?
Hi, Dr. Ronan. Doing so good. I've been looking forward to this episode for a while. We get a lot of calls asking about breast reduction, and I think this is going to be very informative for you. But before we get going, I just want to remind everyone to follow us on social media, where you can see all the latest happenings at the practice. We've got before and after photos, specials, and upcoming events, so please check it out. Back to you, Dr. Ronan.
What is a breast reduction? Breast reduction is a surgical procedure that takes about an hour or so, and with it, we lift the breast up and make it smaller. That would be compared to a breast lift procedure. With a breast lift, we just make it higher. We keep the same volume, but make it higher. With the reduction, it's both higher and smaller. A lot of patients will ask and say, I want a breast reduction and a breast lift. But you don't have to ask for that. Once you say reduction, it includes the lift with it. So why would someone want to have a breast reduction? And typically, it's one of a few reasons. Most of the time, it's a functional reason. They're too big to fit into clothes, too big to fit into bras, have a really hard time finding bras. The hanging of the breasts creates pain in the back, neck, and shoulders. Sometimes we'll see shoulder strap groups, but that is sort of acting like a weight hanging away from the body, really putting a lot of stress on the back, shoulders, lower back. And so the patient will also complain about functional things like exercise and sports, and it's hard to move because once they get going and they change directions, their big breasts want to kind of keep carrying them the other way. And so it'll make life very difficult just getting in and out of a car or whatever you might want to do. It really decreases the function on the person's life. Second reason they'll want to do it is for aesthetic reasons. They'll just think, they just look too big on my body. I want something more proportional and, downsize the fit in the clothes better and have more variety of clothes that, they can wear. And oftentimes it's a combination of both the functional considerations and the aesthetic. Many times there are complementary procedures that are done alongside with the breast reduction. Most common of those would be a tummy tuck and liposuction. And so a lot of patients who are in the population that would get a breast reduction have also maybe had some kids or not, or have a little extra fat, and we'll do a tummy tuck and or liposuction along with the breast reduction in order to sort of contour the body how we want, and then restore the shape and a more appropriate size for the breast. At your consultation, we'll talk about what you want to achieve, and I'll ask you how you want to change your body and have you tell me that, or how things are impacting you. And so a lot of times patients tell me they want a particular procedure, and I'll kind of stop them and say, no, tell me what you want to change in your body, because a lot of times what a patient thinks they need as far as a procedure doesn't match up with what their desires are. And so when doing breasts, a lot of times what I'll do is simulate a lift. And so I'll sort of pinch the skin together and not tell them what I'm doing, but essentially simulate a lift. And when a patient looks at that and says, this is perfect, or, I want something like this, that's a breast lift. If when I'm simulating the lift, they say that's too small, then we talk about an implant. And when I simulate a lift and they say, no, that's too big, then I know that we need to do a breast reduction. And so at that point, I'll be able to sort of pinch some of the volume off to the side and leave a proportionate breast and ask a patient, does that seem about right? And so we can do that so I can gauge about how much we need to remove to leave you with the amount that you want to give you the proportion that you're looking for. Also in your consultation, we might be reviewing other procedures if that interests you. We'll talk about your medical history, your breast history, et cetera, and make sure that you're safe for surgery. Let's talk about your day of surgery for a breast reduction. You'll come check in early in the morning here at the Blackhawk Surgery Center, meet with our team. You'll then go to the OR and go to sleep with our anesthesiologist. You're not going to remember anything or feel anything. Once you're asleep, I'll infuse some numbing medicine that lasts about 3 days. And so that will sort of diffusely go over your breasts. We'll then do the breast reduction procedure. We pretty much never use a drain for that procedure. We'll close you up. It'll all be dissolving sutures. There'll be little tapes over the incisions. You'll be then put into a sports bra, and you'll wake up in our recovery room relatively comfortable, really not having a lot of pain, because you're going to have 3 days worth of numbing medicine in the breast. Most of our patients are taking just Tylenol and Motrin after a couple days. You'll notice when you go home that you already feel the relief in your back, shoulders, and neck. It happens for people even the hours after having surgery. They'll report back that they already can feel the relief on their shoulders and back. Most patients are back to work in office type setting within 1 week. Patients that work from home will often start the next day. We'll start low impact aerobics at about 3 weeks and not doing anything with heavy lifting or straining for about 2 months. Well, okay, Brette, do we have any questions tonight about breast reduction?
We have quite a few, actually. Thank you so much for sending them in. Lena writes in, I've been dealing with constant neck and shoulder pain. Will a breast reduction actually help relieve that?
Most likely, yes. So I'd want to see you first and talk to you first. If you have a problem with a bone in your neck or a nerve, that's a different problem. But the vast majority of people that have big breasts will definitely have shoulder, neck, and back pain, and potentially some other problems. And when we remove that weight, it typically allows all of that pain to go away. Even if you do have a neck problem or a pinched nerve, relieving that weight oftentimes takes stress off of that condition, and you may find some improvement there as well.
Tasha wants to know, how much smaller can I go? If I'm currently a double D, could I realistically get down to a B?
First thing I'll say is that letters are not standardized, and so we don't really like to talk in terms of letters. They mean different things to different people, and so that's one way plastic surgeons should really never talk to patients about letters. So what I would do in the consultation is actually make you a breast and pinch off part off to the side, and we'll discuss how big you want to be. And so we can make you significantly smaller. That's not a problem at all. And by sort of pinching off the excess to the side, we can look at what's left over and determine together if that's a good proportion for you. But yeah, we can sort of vary how much we're removing in order to get you the desired effect.
Renee brings up, I'm only 21, but my breasts have caused me back issues since high school. Is that too young for surgery?
It is perfectly acceptable to do breast reductions on younger patients that are symptomatic. We've done much younger than you, actually. When someone is functionally impaired and they're having difficulty with PE or clothes or sports activities, or maybe being targeted with some comments, they're sort of bringing a patient down, is perfectly acceptable. It's unlikely the breasts are going to shrink on their own, and so we will oftentimes do breast reductions on younger people. And frankly, the result is typically better the younger you are. So the more you go through with life with large breasts, the farther down they're going to go and the bigger the lift is. And so if you take someone who's young with really good skin tone and do the breast reduction on them, then that typically gives you the best aesthetic result.
Camila asks, what kind of scarring should I expect, and do the scars fade much over time?
The most common breast reduction that we do here at Blackhawk Plastic Surgery is a vertical type breast reduction. So the scar will be around the nipple and a line coming down. Some patients will also have a shorter horizontal scar at the bottom of that. What we hardly ever do is a long horizontal scar. So most of our patients will have a lollipop or a short lollipop with a short horizontal. In the vast majority of patients, the scars fade over time. They'll always be there, but they typically will fade with time. If you're having a problem with your incision, like it's pigmenting, then there's different creams that we can put on to sort of bleach that out. And there's also some laser procedures that we can do to help improve the quality of the scar. But the majority of our patients don't really need to do anything after the surgery.
Jade works out a lot. Will a reduction affect her ability to exercise or lift weights afterwards?
It will change things. It'll make it a lot easier for you. And so once you're healed, you'll be able to go back to most all of your sport activities or exercise activities and be more functional. You'll be more agile. You'll be able to move better. You'll have less stress on your back, shoulders and neck. And so typically your function will improve after a breast reduction.
Question from Priya. How long before I can sleep comfortably on my side again?
Typically our patients will sleep on their back, maybe head elevated for the days after the procedure. It helps kind of remove swelling, and it's typically a little more comfortable for the patients. But as soon as you're okay and want to lay on your side, that's fine by me. You'll be in a sports bra and it'll kind of have you protected and sort of held in. But laying on your side's fine. You probably won't want to lay on your stomach for a while, probably at least a couple months. But as far as laying on your side, that can begin relatively early.
Here's one from Zoe. Is there a chance my breast could grow back after surgery?
The answer is yes. There's 2 times when that would typically happen. One is a patient will have a breast reduction and then gain a lot of weight. And so the weight gain will lead to a larger breast. And in that case, that patient might seek a second breast reduction. And that's one way that someone would have their breast tissue grow back. The second way is a condition called benign virginal hypertrophy, or where the breast keeps going. And that's sort of a very rare, more genetic condition where the breast kind of keeps growing over time. And there's a local family here that I've operated on the grandma who had a revisional breast reduction. I've done the mom twice, and I did both the girls at like 13, 15 years old. And then I did another one of them in their 20s, in their late 20s. And so there are some families that it will kind of keep growing, but that's extremely rare. We don't see it very often at all. Well over 99%, we do a breast reduction. If your weight stays relatively stable, you'll never need one again.
Carmen wants to know, how long do I need to take off work to fully recover?
The vast majority of our patients are back to work within 1 week in an office type setting after a breast reduction. Most of our patients that work from home can begin working from home the next day. If you have a very physical job, then we'd talk with you about that, maybe send you back with limitations, but then it might take a little bit longer. But for the vast majority of our patients, it'll be a week or less.
Nina says, I have one breast that's noticeably larger than the other. Can a reduction fix a symmetry too?
The majority of time when I'm doing a breast reduction, one side's bigger than the other. And we'll sort of notate that. And if so, I'll make an estimate of how much the difference is in grams. And after doing this for a long time, I can usually kind of eye and have an idea. It's about 75 grams more or 150 grams more. And when we remove breast tissue during the procedure, we actually weigh it. And so if you're around the same size, then I'll remove around the same amount weight of tissue. And so if we know you have an asymmetry and it's 75-ish bigger, then I'll be looking at that to take off about 75 more grams. And then we'll examine the 2 breasts on the table to compare their side. And we'll typically look from different angles. So we'll look from the sides and from, by your feet and then up over your head looking down. So we can really get an idea of how much volume's on the 2 sides and if we're pretty close with the symmetry. And so it's pretty easy for us to make adjustments if you have asymmetries. But the other part of symmetry, asymmetry is that everybody has asymmetries. We really put a focus on trying to improve them, but every single case before and after will have asymmetries. And some of them we just can't adjust, and they're just normal. The ribs will be a little different shape and they'll make them point slightly different directions. All those sort of things are normal things that you already have and you'll have after a procedure.
Elena asks, will this change how my nipples look or feel?
Typically, we will be downsizing your areola, not in everybody, but most of our patients who come in for a breast reduction have some stretching or enlargement of the areolar complex. And so standard on breast reductions and really breast lifts is a reduction in the size of that down to a more standard size that would be proportional to the new breasts that we're making. If you don't have enlargement, then we can just keep it the size that you have. And so, and with respect to how they feel, after a breast reduction, there'll typically be some numbness, and this could be short-lived or longer-lived, really depending on how much tissue we have to cut out. But the way we do breast reductions, a lot of the nerves are kept intact to the nipple. And so over time, you should have, a nice regain of sensitivity.
Danielle wants clarification. Is it safe to combine a reduction with liposuction around the bra line or armpit area?
The simple answer is yes. But a lot of the time when I'm doing a breast reduction, I'll actually tunnel out the tissue, kind of going back under the armpit or under the arm. And so I'm taking it out with a specimen. So the tissue that I like to remove in a breast reduction is the lowest tissue, so the part in the middle, under your nipple, and then out laterally off to the side. So I really don't take very much tissue at all on the inside. We want to preserve that because that's what will give nice cleavage and a nice shape. It's really all the stuff on the outside and the bottom that is the most bothersome. So I literally cut that out directly. So we most of the time don't ever really need to use liposuction back there. And by removing that heavier outer part and then the bottom middle part, as your breast comes together, your new breast comes together, it sort of comes and joins the part in the middle, and that makes the breast more narrow, round, and kind of projected, and it gives it a really nice shape.
Taryn brings this up. I'm breastfeeding right now, but planning to stop soon. How long should I wait before having surgery?
The simple answer is probably at least 3 months would be good. And that means from when you're done breastfeeding, like kind of like not cheating and keeping some production going. And so why would we want to wait and make sure that your factories are done making milk? Because you can think of the breast as sort of a cluster of grapes. If I'm holding a stem, there's a cluster of about 20 grapes. The milk would be the milk factory. The lobule is where the grape is, and it will be sending milk up those ducts and then out the nipple. If we disrupt the ducts or cut into the breast, then the factory will keep pumping, and the milk, instead of going out the nipple, will just drain into the surgery site, and that's called a galactocele. And so we don't want to have that happen. So we want to make sure that you've been done breastfeeding for a while and that's shut down, and then we can proceed with your breast reduction or lift or other type of breast surgery.
Maya is asking, do I need drains after the procedure, or is there more of a modern technique now?
At our center at Blackhawk Plastic Surgery, I rarely ever use a drain for a breast reduction. In fact, I can't remember the last time I used a drain for a breast reduction. And so the simple answer is no, you won't have a drain if you come here for a breast reduction.
This is our last question, Dr. Ronan. Shiloh says, I'm petite, but have really large breasts. Will surgery throw off my proportions or balance things out?
The answer is we'll actually probably improve them and really probably significantly improve your proportion overall. And so you're probably in the easiest category to deal with. And so we'll pick a volume that you want or something that'll be proportional or look really good on your frame, and then figure out how much we want to remove. But you're probably in the category of the easiest type of breast reduction to do.
Well, thanks. That was our last question. If you need any help, feel free to email me at info@blackhawkplasticsurgery.com. You can call the practice at 925-736-5757. Also, if you're interested in scheduling a free consultation with Dr. Ronan, we have an easy-to-use online scheduler. You can scan the QR code on the screen or simply visit blackhawkplasticsurgery.com and click on the scheduling link. Thanks to everyone for watching. I really hope this helps answer your questions, and we hope to see you in the practice soon. Back to you, Dr. Ronan.
Well, thanks, Brett. Thanks for being here again tonight. And thank all of you for watching BPS Live. We have fun doing these shows for you. We hope they're informative. If you have any questions, feel free to give us a call or ask. Otherwise, we'll see you next time on BPS Live. Thanks for tuning in.